This morning we are catching up with UP Home Health and Hospice. We have Corey and Leslie joining us in the studio today. How are you two doing?
Great.
Wonderful.
Excellent. Yes, so we have kind of a couple different things to talk about this morning, and one of them is about services that you guys provide. You know, going through hospice is a difficult time for family members and friends who are close to the people that are in hospice. And one of those ways is through grievement and bereavement support, grief support, correct?
Yes. Yeah, we have the hospice program itself actually offers a 13-month bereavement program. While we do a lot to care for the patients and the families, hopefully for many months and years if they enter hospice at a good time, we are still there. That doesn't just end after that. We are there for them for grief support, memorials, and just ongoing support with these group programs and one-on-one if necessary for that 13 months.
Okay, and so are these group things? Is it individual? How does that work?
Anybody from the public can actually attend. We have two different locations. One is in our Ishburning office, and that is every Tuesday at 4 p.m. And then we also have one at Love Mark Church here in Marquette, and that's on Thursdays at 6.
Okay.
So it's every other week is when we hold them.
Okay. Do people need to sign up, or can they just show up?
They can just show up.
Yep. And that's one of the good things about this program as well, is that it isn't just for our patients. So lots of people maybe lost a loved one, not in hospice, or have something that doesn't have anything to do. Grief is such a wide-ranging issue that if there is anything that they're working through, it's a really great group of people to kind of come and find out that you're not alone in your grief, and to have some help work through that.
Yeah, for sure. Yeah, it sounds like a great opportunity for anybody who needs it, sounds like.
It is.
Yeah, and kind of switching gears now, I mean, you know, what you guys do is so impactful, and you need a lot of helping working hands to make what you guys do a success. And so you guys are looking for employees, volunteers. What's kind of going on with you guys there?
Yeah, for the purpose of, we always just like to tell people who are looking at a new position, whether or not it's in healthcare, if they're a nurse, if they're a social worker, you know, have they ever considered in-home care? November coming up is National Care at Home Month, so we like to use that as an opportunity to tell people, you know, if you are working as a home health care or a hospice nurse, you have the ability to go into the home. You have managed census. You have different hours. It requires some autonomy as a nurse, but we have a great training program, and just when in doubt, we always say encourage people, if they are interested in something like that, to reach out to us. But for volunteers, hospice was built on volunteers, so we do some quarterly volunteer training programs that Leslie knows a lot more about.
Yes, actually we have one coming up November 8th. It is an all-day situation, so about from 9 to 2, but we do offer breakfast and lunch, so that's kind of nice.
Excellent, yeah. And how can they register to get involved with that?
You just give us a call, or you can email, but 906-485-4545, and ask for Leslie, or anybody can sign you up.
Okay, for sure, yeah.
And I think it's important to note too, with volunteers, a lot of people think, oh, you know, hospice volunteering. Really, you know, the orientation will go through all of the things that you kind of need to know about it, but you're just kind of going in as companionship, to make a new friend, to talk to somebody who might have some more stories to tell, and you know, to sign up to just kind of find out a little bit more. I was a hospice volunteer in high school, so if I could do it in high school, I like to say just about anybody can do it. And so just learning a little bit more at that orientation to decide what type of volunteering you'd like to do within the organization.
Right, yes, and so there's the companionship role. What other roles could people expect, maybe if they do want to be volunteers?
Some house cleaning, light house cleaning, snow blowing is going to be coming up soon, mowing lawns, that sort of thing. Maybe going shopping for them as well.
So what else is going on for you guys over at UP Home Health and Hospice?
You know, as I mentioned before, November is coming up, and that's National Care at Home Month. It used to be called National Hospice Month, so we still like to refer to it as that. So we work with our friends over at Lake Superior Life Care and Hospice to host a couple of different educations. Really, the goal of that month is to talk to people about about hospice. We've gone leaps and bounds over the years to kind of move away from people's thoughts that hospice is about dying and it's about the last week of life. Hospice is about living. Hospice is about living with a life-limiting diagnosis, and by working with Lake Superior Life Care and Hospice, we like to spread that message out to the community at large. So we just encourage people to keep an eye on both of our websites and our Facebook pages for different events that the senior centers will be hosting, different community awareness campaigns throughout the month as well.
Leslie, Corey, thank you both so much for being here this morning.
Thank you for having us.
Yes, and we will have all that information for you on our website, myupnow.com. Stay with us and we'll be right back after the break.